welcome to my channel. If you're new here, my name is Sara. I have a 21-month-old son named Sulaiman, and I am expecting baby number 2 on February 14th, 2020, inshallah. We know that the gender of this baby is a baby boy as well, so this will be our second son, and I'm looking forward to that. I explain everything about having a second son during our gender reveal video, which I will show somewhere up in the cards. If you enjoy motherhood and pregnancy related content, please be sure that you like this video and subscribe for more content. I try my best to upload regularly. Last week I missed my Friday upload. I'm sorry guys, I was traveling quite a bit, but I do upload about twice a week, usually Tuesdays and Fridays/Saturdays. So with that, let's get into the video. Usually I start my bump dates by talking about the baby and their development. Right now they're a little bit over 14 inches and almost 2 pounds, about 1.93 or so. They're about the length or size of a papaya or a bunny rabbit, if you like those type of chart comparisons. At this point, at 26 weeks pregnant, the baby is developing quite rapidly in terms of their lungs and their liver and their brain, as well as their immune system. They may seem more active this week, and it's because there's less amniotic fluid this week and going forward as the baby is taking up more space in the uterus. This week as well, the sucking reflex has strengthened quite a bit, and this is to prepare them for feeding. So you might find that the baby on ultrasounds is sucking their thumb a lot more often than they were before if you are doing regular ultrasounds. The baby's brain development has come along quite a lot over the past few weeks, and right now their brain wavelengths are similar to what they would be like when they are a newborn. They also have a lot of neurological development as far as their neurons and just general brain waves becoming more consistent than they were in previous weeks. The baby's skeleton is developed, but their joints have not quite developed yet, so although the skeleton is present, there's a lot of joint development happening this week. So be sure to take your magnesium and calcium to help with that as well. As I mentioned before, their immune system and their lungs and liver are continuing to develop, so that's major development happening this week and going on forward as well. The baby's eyes are beginning to open more, so if you take a light, or if you were to shine a light on your belly, your baby may open or close their eyes in response to that, which is pretty amazing. And the retinas within the eye have begun to develop more this week. There's a lot of baby development that's been going on this week. Now, what's going on with me as far as 26 weeks pregnant? And this week in particular was quite a difficult week for me again. With the travel, I think it added to the symptoms that I was going through. And you can tell my voice, I'm a little bit sick. I have a lowered immune system, as most pregnant women do. I am going to be getting the flu shot once I've recovered from whatever it is I'm going through right now. I do recommend that to anyone else who's pregnant. If you can get the flu shot, get the flu shot. Get your spouses to take the flu shot, and anyone else who's going to be around your newborn. And the reason I'm saying this is because I learned my lesson with my last pregnancy. Last pregnancy, I did get the flu shot. My husband did not. What happened was, he came home from a conference and he gave our newborn the cold and flu, which manifested into bronchiolitis, and it took weeks to fight off, and we went to the hospital, and it was quite a traumatic experience. It's not worth the risk. If you can take the flu shot, take the flu shot. The DTaP that's going to be happening, the whooping cough vaccine, and I will also be taking that. I highly recommend speaking to your doctors and seeing if these are options for you and discussing it with them further. Speaking of my doctor, I actually haven't seen him in 6 weeks, which is a really long time. We'll be seeing him this week, and then I will hopefully share the ultrasound and all that in next week's bump date, my 27-week bump date. What I'm going to be talking to him about this coming appointment is heartburn. I have really bad heartburn now, and I never had this with my son's pregnancy, although he was born with a lot of hair, so don't believe that myth. I just started taking the Tums Chewies, which are equivalent to 5 regular Tums, so I take 1 a day. Swelling has continued. It's a little bit less in my face right now, but it's still pretty bad in my feet and in my legs. It's still pretty bad in my legs and on my feet, which is really uncomfortable. Another weird symptom I've been having this week is I've been getting bruises on my legs. Seeing the bruises has me a little bit on edge because, of course, if you Google it, you're gonna get a slew of scary results. and I don't trust Dr. Google, so I'm going to ask my doctor about it and see what he has to say. Maybe I'll get some blood work done. I am due for blood work anyways for my thyroid. I have hypothyroidism, and I've already had my dose adjusted once in this pregnancy, so I'm expecting it to likely be adjusted. I'm also expecting to get the RhoGAM shot, and I will also be doing glucose testing. So there's quite a lot coming up in the coming weeks. Another major symptom that I've been feeling this week is round ligament pain. Now, I've had it in previous weeks as well, but it's definitely started up again this week. I feel sharp pains, and I did experience this last pregnancy, so I know it is round ligament pain, and it's usually when I'm in a weird position or if I move suddenly that this pain will happen. And rib pain is another one, but rib pain is new for me because my son, Suleiman, in his pregnancy was very low. I had something called placenta previa. So my son never really touched my ribs. This baby is. This baby is kicking high. They are much higher than my son's pregnancy, and it is causing some major rib pain for me. If you have had this pain in your pregnancy or previous pregnancies, let me know in the comments below, because I've never experienced this, and this is my second pregnancy. The last symptom that I've had as of this week is nothing tastes good. It is the strangest thing. Things that I even typically crave or enjoy, they don't taste good. They taste really off. So I don't know if that's a normal symptom or not. I will also be bringing that up to my doctor. My doctor, by the way, calls me Miss 150 because in my last pregnancy, I would go in with 150 questions. And with that, I'll show you guys the bump. So this is my bump from the front, you can see. This is my bump from the side. And you can see it's much higher than it was before. And he's right here, as you can see. He loves sticking himself out right during my bump dates, of course. So my bump has officially definitely surpassed my chest at this point. And that's 26 weeks. And with that wraps the 26 weeks pregnancy update, or my 26-week pregnant bump date. If you like these types of videos, please be sure that you like this video, subscribe for more content, and have your notification bell turned on for future bump dates. I try to post them every Tuesday. I also have a video that goes up every Friday or Saturday. And until then, I will see you guys next time. Bye.